Welcome to Medicine Handy Point. Today we will discuss briefly surgical management of aortic regurgitation, our latest from Cmdt book. So let's start. So aortic wall replacement is recommended only if the patient has become symptomatic. Actually, a large of regurgitant volume can be accommodated by the heart, and once the patient becomes symptomatic, it means that the heart capacity is giving up. So the patient should get a aortic wall replacement before the heart gets decompensated and goes into heart failure. If the ejection fraction falls below 55%, means the heart is about to fail, so we should get aortic wall replacement before it is too late. If the end diastolic dimension of the heart is more than 65 mm, means we should get aortic wall replacement. If the end systolic dimension is more than 50 mm, it means that the heart is getting dilated and the aortic wall replacement should be done. If above indications are not met, but there is evidence that the left ventricle is getting dilated, means is about to fail, on serial echo monitoring, we should do aortic wall replacement. I hope you like this brief video and please subscribe to the channel.